Marks the 10th anniversary of the United Nations Zero Discrimination Day. UNAIDS is calling for non-discriminatory access to universal health. That's regardless of gender, age, sexuality, ethnicity or HIV status. I'm joined now by Zeenat Abdool, Communications and Advocacy Officer for UNAIDS South Africa. A very good afternoon to you, Zeenat. Thank you for your time. It's an important day to highlight on one's calendar and get a bit more depth on as we try and make sense of the impact of discrimination in the various communities. Talk to us about the significance of Zero Discrimination Day.
Thank you very much, Umbo. Good afternoon to you and to your viewers indeed. So Zero Discrimination Day was established by UNAIDS 10 years ago to advance equality and fairness for everyone. People most vulnerable to HIV experience intersectional stigma and discrimination in their daily lives on the basis of their sex, gender identity, sexual orientation, HIV status, disability, socioeconomic status, drug use, and sex work. So HIV-related stigma and discrimination continues to be pervasive. So on this 10th anniversary of Zero Discrimination Day, which is observed on the 1st of March annually and across the whole month of March, UNAIDS is reminding the world that by protecting everyone's rights, we can protect everyone's health. And protecting everyone's rights is not a favor to any group, but it is the way that we can protect everyone's health, end AIDS, and create happier societies for all. Yeah. With regards to the particular theme that we're looking at this year, which is, and like I've mentioned, to protect everyone's rights, protect everyone's health, evidence shows us that where there's programs in place to respond to stigma and discrimination, access to services for HIV prevention, testing, and treatment has improved considerably. And people living with HIV who perceive high levels of HIV-related stigma are 2.4 times more likely to delay enrollment in care until they are actually very ill. So removing laws criminalizing sex work has also been estimated to avoid between 33% and 46% of new HIV infections among sex workers and clients over a 10-year period through the combined reduction of violence, stigma, discrimination, or arrest, and increased ability to negotiate condom use and access to health services.
As we're gradually seeing attacks on the hard-gained rights of the marginalized in our society, how is this being carried out? I mean, you speak to some gains on one end, but we know that, the worst is not over.
Indeed. HIV-related stigma and discrimination continues to be pervasive. And if I can quote, in 2020, the 2020 and 2021 people living with HIV Stigma Index 2.0 survey, which was conducted by the people living with HIV, the LGBTIQI+, the disability and the sex worker sectors in partnership with the Human Science Research Council. A study was conducted in 3 provinces in South Africa, in KwaZulu-Natal, Mpumalanga, and the Free State, and 6 districts were chosen or selected, and they found that 10% to 27% of people living with HIV experienced stigma, and 14% to 31.5% of people living with HIV reported internalized stigma. And the group that is most or experienced the highest levels of internalized stigma was actually the 15 to 24-year-old age group. In addition to that, this is a 2020-2021 study, but just yesterday, a community-led monitoring report that is titled The State of Healthcare for Key Populations in South Africa was launched by the Richitse organization and initiative, and they revealed that people who are queer or trans, who use drugs or engage in sex work, often face uncaring, disrespectful, cruel, and even abusive treatment at public health facilities. This is a report that was just released yesterday. The report highlights confidentiality violations and also details an alarming number of people who have been refused health services within the last year because they are LGBTQI or trans, or they use drugs or do sex work. And I just want to highlight to you that, we talk about stigma and discrimination, and when people think of stigma and discrimination, we think of labels that we use issues, or, we don't think that he has any harm. But when people begin to fear that they're going to be stigmatized, it actually denies them access to healthcare. And some of these cruel comments are actually being made by healthcare workers, as indicated in the report that was launched yesterday. And when people don't access healthcare, they become sick. When they become sick, they cannot work. When they cannot work, they do not have an income. So this puts them at risk of poverty as well. And this is why we say that to protect everyone's rights, basic human rights, we need to protect everyone's health.
You touch on something very important there, the remarks by healthcare workers also having a significant impact on how people access healthcare and what then happens to their health, obviously resulting in deterioration. How then do we begin to have a conversation around changing attitudes of healthcare workers? I mean, if you speak to healthcare professionals, some will talk about the stress levels in the job, not having enough resources and dealing with a lot of people, staff shortages as reasons that may perhaps exacerbate the way in which they treat their patients. What needs to happen in that space?
Look, I mean, not just particularly in that space, but in general as well. I mean, we are guided by South Africa's National Strategic Plan for HIV, tuberculosis, and sexually transmitted infections, the NSP as we know it. And it promotes a new and urgent focus to reduce inequalities. It includes deliberate efforts to remove barriers to accessing health and social services, including addressing stigma reduction and promoting and protecting gender equality and human rights principles. So UNAIDS recommends 7 key programs for eliminating HIV-related stigma and discrimination. And this includes stigma and discrimination reduction, HIV-related legal services, monitoring and reforming laws, regulations, and policies on HIV, legal literacy. When people know their rights, they know they know the way in which they should be treated. Sensitization of lawmakers and law enforcement agents, training for healthcare providers on human rights and medical ethics for HIV, that speaks directly to your question, and reducing discrimination and violence against women in the context of HIV. Yeah. South Africa has also signed up to the Global Partnership for Action to eliminate all forms of HIV-related stigma and discrimination. And this requires countries to take action against stigma and discrimination across 6 settings. And these are healthcare, justice, education, the workplace, community, and humanitarian settings. Yeah. So we're looking forward to working with the country to deliver the 7 key programs across these settings.
Very well. Thank you so much for speaking to us there and weighing in on this very important discussion. Zeenat Abdool, who's the Communications and Advocacy Officer for UNAIDS South Africa.